Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We've got a little known secret today why your low back pain's not getting better, and we're going to share it with you.
Excellent, Bob. It's one of those things that after a number of years in the therapy business, it's like,
Yeah, we know this. We've seen this many times, and also I'm not very good at keeping a secret, so that's why I'm going to share it with people today. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, once again, you're going to want to go over to our Facebook page, Bob and Brad, because we are giving away 5 TENS units. These things are great for reducing your pain, especially chronic pain.
right.
We are also giving it away on YouTube. I mean, you can sign up for the contest on YouTube. It's under, let's see, giveaway TENS unit. It says that's the title of it. It's you know, we did it like a week ago.
Sure.
Just scroll down, you'll
Yep.
find it. So, 5 of these we're giving away. That's a great deal.
Yeah, that's wonderful units. I can't wait to work more with them in the future.
So this, I just had a patient this last week, Brad, that this happened to, and that's why it reminded me that this is probably a good video to do.
Sure.
So he came in. Do you mind turning around, Brad?
Well, of course not.
Okay, your best side.
Yeah.
He came in, he was having pain right here. And you go, okay, he's having pain in his low back. Well, what I find really quite common actually is the problem is right here and it sends pain into the low back. Quite often, if you're having low back problems, it actually goes into the upper buttock or buttock area.
Right, and sometimes down into the legs.
Right. Do you concur with this, Brad?
I concur. There.
All right.
It's called referral pain, and it's everyone's pretty aware of it.
Yeah,
in the
I mean, a
therapy
really
world.
bad example of this is probably a heart attack. You're having pain, the damage is happening in your heart, but where's the pain? Up in your throat, down your arm, could be in the back.
Right.
So
Where the source is the heart, but it refers to different areas. Same thing in the back.
So what one area that I often check, is a lot of times I just go and push along the back here and it starts, ow, 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 and it hurts up in here. And it actually doesn't hurt when I push down here. So that's one way to test, but there's a lot of other tests. That's not the purpose today. The purpose today is to show you some of the things to do for your mid-back.
Sure.
If you're having mid-back pain. So the first one is, we like this one, the ball in the chair, Brad.
Oh,
we'll use
yes.
this
Bring
one
a
right
chair.
here.
I got a ball.
We'll let Brad do the honors.
Yeah. So get a ball, like a 6 or 8 inch ball, and it's nice to have it if it's a little bit soft and squishy. If it's really firm, it doesn't work as well. So go take one from your child or your little brother or whatever it takes, and let the air out.
The little kid down the street.
Yeah, but give it back, of course.
Yeah.
There we go. So you're going to put it, and you'll know because the height of where you put the ball will make a difference, but it'll feel like, oh, that's the spot, and you're going to stretch back over that ball. Sometimes you'll get it like it hurts a little bit more, but if it's a hurts so good pain, and as you do more, clearly improves, then you know you're on the spot. You may have to move up a little bit, and again, you experiment, and you'll find out. And you'll say, oh, and I had this with patients many times. Just a matter of fact, last week, he said, oh, it hurts a little bit, it feels kind of good, and it's getting better the more we stretch. That's when you want to continue with it.
Yeah, I can tell you 3 examples this year where I gave the person, somebody I knew, I wasn't really treating him formally, I just gave them that one exercise and they got better.
Sure.
I mean, that was just the one exercise.
Yep.
But I got to point this out real quick, Brad. Again, you say height. Is there anybody else that says height? I say height.
Height.
I mean, height.
Yeah, I'm going to study. I'm going to be an English major.
No, I'm not
someday.
saying it's wrong. I just don't know. Do other people say it that way? But anyway, okay, we're moving on.
With the program.
All right, the next one is you can actually just do a plain stretch called the hallelujah stretch over the back of the chair, especially if you have a chair that hits you about right. Some of the chairs that hit you make you a little bit below your shoulder blades.
Yep.
And you can just do some of these without the ball. I'm just trying to say, if you didn't steal the ball from your little brother or sister or from your little neighbor kid.
Nephew, niece. The height of the chair, if it's too high, if it's up around the upper shoulder or low neck, that's probably not going to work.
Yeah, it makes it hard to do. It's really nice if you can kind of lean over the back of the chair. This one's a little borderline for me. I'm tall, so I'm kind of getting close, but it's still a problem. So, all right, the next one. This is a source of great controversy all the time, too, because we don't know what to call it. It's called cat camel, we call it. We don't know which one's the cat, which one's the camel. And there's a yoga term for it too, which we always forget.
Right, yeah, so we apologize, but we're not too concerned about what you call it, but as long as it's effective. And
So
it
we're trying to
works.
get some mobility in the mid-back, and this actually does loosen it up. I've done this one myself sometimes. As you can see, when I go down, I hump the back up and I bring my head down. And then when I arch the back down, I bring my head up. So I'm just getting some mobility in there.
Now, Bob has got really good range of motion, particularly when he arches. I've worked with a lot of people, particularly if they're a little older.
Yeah, you might see them going like this. They can't even get any motion hardly.
Right.
It's like a rock in there.
And I don't have that kind of emotion. My back does not extend, but I can still do the exercise to regain as much as you can.
And you can go ahead and do it, with all these, you can do a good set of 10.
Right.
I mean, and you can do them quite often. You
Sure.
can do them 5 times a day if you like. So where are we at, Brad? We're now at, supine trunk rotation. So this is just one you can do when you wake up in the morning or before you get out of bed. You can actually,
supine.
yeah, the supine. You're just going to go ahead and rotate your legs back and forth. There's a lot of rotation that occurs in the thoracic spine,
Yep.
the mid-back.
Right.
So you can, and actually the more you bring your legs up, the higher up the back it goes.
Sure.
And if you really want to stretch, you can actually try to bring the leg over like this, but you can see I'm grabbing on here so I don't go rolling off the bed.
Right. And,
So-
if you do this on, a carpeted floor, you don't have that potential to fall off the bed because you're not on a bed.
The bed, yeah.
So again, keep your feet together close, and you can see Bob is rotating when he goes this direction. See, this hip is coming off the table, but his shoulders are flat on the floor of the bed, and that's going to get that mid back to stretch out.
You're getting low back too.
Right, yep.
It's just it's getting both of them. It's just like it's one I like that you can do in the bed before you wake up.
Sure.
Right when you wake up, before you wake up even. I guess you could do it in your
You can
sleep.
do it in your sleep, I guess.
Sure. All right, next one, Brad, is standing extension with a belt.
Okay.
You can use a belt, or you can use a rolled up towel like
Yep.
this. And what's nice about this is you can get it at different levels.
I may start here and extend back this way.
Yeah, show what you're doing with your arms, Brad.
So I'm grabbing either the belt or the towel. You're going to push forward and kind of up at the same time. So I'm going up this way, like trying to get taller. And, it just feels good. It opens up things. And what I'm doing, I'm going up about an inch or so every time. You can see I'm wiggling that towel roll. And, once you get up by your armpit area, it's as high as you can go, and it's not as effective. But you can start over. I like to start low and just work up and do a stretch for a second or two in each level. And if you find one level that particularly feels good, then continue to work on that, more repetitions.
And what I would say, you don't need to do all these by any means.
Right.
If you find some of them are working, do those. If you find one that works, maybe just do that.
Right.
I mean, we're busy people. We don't have time to do all these exercises,
Sure.
but we're trying to give you a whole smorgasbord so you can pick one of them.
Right.
All right, the next one is, what are we doing next? Oh, standing rotations with overpressure.
Ah.
Now you can do this with like a booyah stick, where you can actually put it behind your head like this, and you can rotate like this. You can actually put it in front of you and go like this, and even push it a little bit and give
Sure.
yourself a little. Don't push into a painful direction. If I hurt going this way, what I would actually do is work it going this way for
Right.
a while. And you can do it with a golf club. I do this with a golf club actually, and I'm in really good posture when I do
Yeah.
this. Really good posture, as good a posture as you can be in.
The one thing you can do that makes it different, if you sit down and do it, it locks your pelvis in, and then you
Exactly.
actually, it's a little more aggressive on the back. So it may or may not be the thing to do. Like Bob said, you try one or try the other and do the one that offers you more relief and more stretch.
Yeah, don't go into a direction that's painful. Gently if you do
Right.
it. And you can actually do this, Brad, with your arms too.
Sure.
So you put your fist into your palm like this, and you're going to go like this, and just give yourself a little extra push.
Right.
And it can mobilize you into the one direction. And it feels good this way, go ahead and work that way. If it doesn't, just work the opposite direction.
Sure.
So, all right, the last one we have, Brad, is, we want to strengthen your back. We want to strengthen
Sure.
that mid-back.
Yep.
So you're going to show the wall anchor.
Yeah.
So this is I've come up with a new name for it, by the way, Brad.
What?
It's the workout wall anchor.
Okay.
The workout,
WWA.
yep, the workout wall anchor.
Okay. So you got a nice band, and you know, if you got the wall anchor, it's easy just to connect it on there. And we're going to work just some what we call scapular retraction, and you can do it so your hands come back into your armpit area.
So he's squeezing his shoulder blades together here, and he's getting some great strengthening for that mid back.
You can do it down here.
Yeah, and this one, you know, that's why we like the wall anchor. If nothing else, if you know, we'll have it down below in our products. Brad and I invented this, and you know, nothing else for if you want to get one for posture. It's just worth that. But of course, you can work all the muscle groups. But
you know, there's 3 of them. It's nice to put one up high because that works a different muscle group. It gets those lower traps, which is a really important muscle group. But that's a really nice option to work with that.
so, all right, very good. I think we covered it all. Thanks everybody for watching, and make sure you subscribe if you haven't already.
Right.
We haven't begged you enough. All right.